In those days, they did teach the doctors a little bit on anesthesia,
Uh-huh.
and he had had a little bit, and so he would watch over us and tell us what we were doing. He had a little gas machine.
What agent did you use?
I think we used a lot of ether, of course.
Yeah. Did you drop
But
it
we
on
had
the...
oxygen and nitrous.
Oh.
And I can remember we giving even gallbladders at that time. But usually it was a tonsil or something like that. And the three of us would take turns doing the anesthesia. Well, 2 weeks after we arrived there, they invaded Italy.
And where in Africa were you?
We were in Oran.
Oran, Africa.
Out in the country,
Okay.
prairie land.
Uh-huh.
And it took a while to set up 600 tons of material, each one. 600 tons.
What kind of what was giving anesthesia like? What did you use?
When we set up with, it would be like at home.
What kind of agents were you using then?
Well, we had nitrous and, of course, always oxygen, and we had good equipment there.
Mm-hmm.
It was just...
Sodium pentothal or ether or both?
Oh, we had pentothal, yes, lots of pentothal. Up after we got up, when we were terribly busy, pentothal was just, that was it. Nothing else.
Did you use
We
any
had
narcotics?
We had 8 tables going all the time, day and night. And we had 4 gas machines.
Oh my.
Dr. Hamilton, they would choose the patients that we of course had, when they come in by train loads from the bilge, 300 to 500 at a time, day or night. Surgery was running day and night up there after we got up there, but down here it was just normal.
Down here meaning in Africa. Up there meaning in France.
That up there is in France.
Okay.
Uh-huh. And but up there, our pentothal was 5 grams at a time in bottles.
Mm-hmm.
It always came 5 grams, and then you had 12-hour shifts, and then 2 more hours each shift would stay 2 more hours to have enough pentothal ready, and everything cleaned up, and so that it would last the next one 8 or 12 hours, and they would do the same. So our shifts were 14 hours up there, day and night, and for weeks and months. And we had teams that came in. We had a maxillofacial team, we had a brain team, and there were some others too, I'm sure. And the brain team had a nurse anesthetist with it, and her name was Evelyn Lombardo. She was a cousin of Guy's.
Guy Lombardo's cousin.
And we kept track of her for years, and she was a darling, just a darling. And what an experience.
Now, did you ever use...
I threw something away the other day, and I'm sorry I did, because Dr. Hamilton, he was the only doctor you see on it. Uh-huh. And it said that in one room he had 5 patients. He had a pentothal bottle in the middle, had streamers out to all 5 of them. Pentothal,
Pentothal drip?
Pentothal drip, and he was conducting all of these. They each had we had the medical men and dentists or anybody. The boys that were students up here, they took them in right away, of course. They were all giving anesthetics during those that time.
Ever have any problems with explosions with ether?
Boy, did we ever have wet blankets around.
Lots of wet
Because
blankets.
sometimes you had to use them. And we have pot-bellied stoves, and that was one of our that was our duty to keep it keep the stove going.
And you were using ether. Oh my.
Well, occasionally,
Wow.
if we had to, and then we would have wet blankets or sheets, strung around.
And where all did you put those wet
Very,
blankets?
very careful.
I bet you were.
That we were. And we didn't have a single casualty.
Wow.
All those people, I can't believe it yet. Our records were, didn't have time for records.